Thanks.
No, that's fine.
Okay. Good afternoon, everybody. My name is Marie Tringy. I am the Director of the Office of Family and Sanctity of Life for the Epilogue of St. Maron, and I would like to welcome you to this seminar, Innovations in Women's Healthcare. Thank you for making the time to be here, and I want to thank everyone that made this event possible, starting with Sayyidina Bishop Gregory, who encouraged me to do these kind of seminars in the Epilogue, and Abuna Dominique, who welcomed the idea of doing it here, and Christian Rada from the Diocese of Brooklyn, who is co-sponsoring the event with us. And I want to thank Dr. Eleanor for her presence with us, and I want to thank my husband, who's been very supportive and helpful to me in all of these different efforts to really spread the message that we're bringing to all of you today. And to everyone who made this possible. Without further ado, I'm going to introduce briefly our bishop, who will lead us in opening prayer and opening remarks, and so we can continue with our seminar. We're so blessed to have Sayyidina Gregory Mansour, our bishop, since the year of 2004. Our bishop has served on the USCCB Committee of Pro-Life Catechesis and Evangelists for many years, and our bishop has a great passion for the pro-life message for families and marriages, and because he understands the importance of this work, has been encouraging me since the first time I met him to try to get this message to all the ladies. I have to admit, the first time I met him and I told him I teach natural family planning, and he was so excited. I was like, wow, finally someone, Maronite Lebanese, who understands what we're talking about. So thank you, Sayyidina, and please.
Thank you, Maurice. Yeah, I do have a passion for this, and I'm very, very happy that Maurice and Peter came along to help introduce this to many of our young people in our parishes and youth. So, Doctor and your husband and Christian and Father Dominic and our small but mighty group who's here today, and those who are watching us on social media.
5 people so far.
Oh, 5 people have joined us. Well, welcome to all of you. Let us begin with a little prayer. In the name of the Father, the Son, and the Holy Spirit, amen. Heavenly Father, we thank you for the gift of woman and man. And from the very beginning, you wrote within their very nature a beautiful pattern of life for them both. We thank you in particular for how complex yet beautifully made that we are. We thank you for the gift of science, that through reason and faith we can come to know the truth of the design in our very nature, and we are made for love. We thank you, Heavenly Father, for NaProTECHNOLOGY and for the great science of coming to know the natural fecundity of woman and how man comes next to her to help the two of them, help God bring another generation into this world. We ask you, Heavenly Father, to bless this time and bless this knowledge, that it might increase our devotion, our appreciation, our awe and wonder for how marvelously we are made. We ask you to bless this time through Christ our Lord. Amen.
Thank you. Thank you so much. Last time we did this seminar, it happened to be also in May. And again, we're doing it in May. And I remember Sayyidina said last time, Our Lady, the month of Our Lady, and this is for ladies, and Our Lady is for all ladies, and the church is for all ladies. And that's why we're trying to bring this message to all people out there, to couples, to all ladies from different ages. So thank you for everyone who's here. I want to just introduce now the director of the Respect Life Office, Marriage, Family Formation for the Diocese of Brooklyn. The Diocese of Brooklyn is co-sponsoring this event along with our Epilogue, and I want to just let Christian say a word for us. Thank you, Christian.
Thank you so much for having us here in the Diocese of Brooklyn. Unfortunately, Bishop DiMarzio isn't here today, so I'm here as his representative. You know, I'm much more younger and handsome. Yeah, I said it on Facebook Live, it's okay. So I just want to just briefly say to thank you so much for coming out today on this Saturday to learn about natural family planning. I just want to give you just a brief history for myself how natural family planning has affected my life and also in my marriage. I got married in 2014, geez. When I did marriage preparation, I was introduced to natural family planning. My wife and I were a bit hesitant. Yes, we were good Catholics that would go to Mass every Sunday and we would follow the teachings of the church, but we were a bit hesitant about this. We weren't fully committed to it. It wasn't until later on that we discovered that there was something missing in our marriage and that we weren't fully giving of ourselves. And it wasn't until we were reintroduced to natural family planning that it actually, I believe, saved our marriage, our young marriage, but also grew into something much, much more than what it is. 3 years ago, we were blessed with our first pregnancy. Unfortunately, Thomas was called up to heaven before he was born. And it was a really tough time for us. And even with natural family planning, we tried again. And now we have a 18-month-old son named Stephen, who would be here with us today and with his mom, but he's napping. So we keep all of them in our prayers, but I also just want to say on behalf of the Diocese of Brooklyn to thank you so much and to have this collaboration with all of you. So thank you so much for coming.
Thank you, Christian. Thank you. Without further ado, I'm going to introduce our keynote presenter. Dr. Eleanor Snowden, Epilogue, is a graduate of the University of California, Davis School of Medicine and a diplomat of the American Board of Internal Medicine. She has been in primary care practice in Fairfield County since 1990. Her journey in the Catholic faith led her to study NaProTECHNOLOGY in order to offer women life-affirming, holistic alternatives to the pervasive use of artificial hormones and intrauterine devices. She earned her Natural Family Planning Medical Consultant certification through the Polycystic Institute in Omaha, Nebraska in 2016. And now she sees NaPro clients within her internal medicine practice by referral from fertility care practitioners. Located in Shelton, her practice is affiliated with Yale New Haven Health. She's a member of American College of Physicians, the Catholic Medical Association, and the Order of Malta. She received the Diocese of Bridgeport Compassionate Care Award in 2016. Dr. Eleanor Snowden, thank you so much for being with us. And I'm grateful to Dr. Carpentier for introducing me to you.
Thank you very much for your gracious introduction. Thank you, Christian, for your beautiful testimony. And thank you, Bishop Gregory, for organizing this conference. Can everyone see? Am I in your way? Okay, so I hope today to give you an understanding of the scientific background of NaProTECHNOLOGY. That stands for Natural Procreative Technology, which is a science of understanding how the woman's cycle works. It's completely scientifically based on research and findings which I will explain to you. It's been proven effective by many, many years of validation, and more good news about it in this season of good news is that it is completely in accord with Catholic teaching and with helping couples live out their faith. The NaProTECHNOLOGY is based on a pre-existing natural family planning system that was called the Billings ovulation method, that was specifically to help women track when they were fertile and when they were not fertile based on observations they could make of a visible, what we call a biomarker, which is the visible mucus that every woman has over the course of their cycle. That was a fairly crude way of doing it. It was sort of it's either there or it's not there. Things weren't really quantified. There were no measurements of what was going on hormonally with the women. So NaProTECHNOLOGY built on that, and currently it's taught by practitioners such as Maurice, who help a couple really understand how to observe what's going on from day to day, and that can help them see what's going on with their fertility, understand the woman's health, and give a window into everything actually that's happening inside of the woman's body. Now, why did this come about at all? In the 1960s, there was a big push for contraception. The birth control pill became widely available. It was becoming more accepted to use artificial means of contraception. So the church really had to take a position on this. And after significant discernment, Pope Pius VI issued Humana Vitae, which is a beautiful document. If you haven't read it, it's definitely worth reading. It's not very long. You can read it in just an hour or two at the most. And it really makes a beautiful case for, and I'm sorry this is so small, but specifically what Saint Pope Paul VI explained as the unitive and the procreative significance of the marital act being important to keep them together. That if you try to separate the procreative aspect, the aspect that allows for fertility and bringing about life, it actually destroys the unitive aspect at the same time, because it basically negates the love and the gift of life that's inherent in that act. And I think Christian's beautiful testimony of how you noted something was a little wrong at the beginning, it kind of points to that. Pope Paul VI was also aware that married couples were struggling with how to manage their offspring, that there might sometimes be a need to limit the number of offspring, to space the number of offspring. So he was cognizant of that, and he wanted the church to answer that problem in a way that was consistent with faith. So at the end of Humana Vitae, he issued this challenge to men of science and also to medical professionals to use their knowledge in a way that was in keeping with the faith, to build on science with the inherent understanding of this man of great faith, Pope Paul VI, that science is in the service of God because it's all part of God's creation. And as we explain things scientifically, we're explaining how God's creation works. So based on this challenge, one doctors and scientists answered it, but Thomas Hilgers, who was an OBGYN resident in 1968 at the time of Humana Vitae, was really taken with this challenge and made it his life's work to use his scientific background to explain the intricacies of the woman's cycle and exactly how it worked on a hormonal basis. So he began to enlist female volunteers to track their cycles using this method where they observed the biomarker of the day-to-day mucus, and he developed a system of quantifying it based on the amount and other qualities that it has. In looking at thousands and thousands of cycles, he was able to discern that there's a big variation in many parts of the cycle from women to women, but there are also certain qualities that are similar, and that in many cycles that appear normal, women can be having all kinds of problems. So he used ultrasound and blood tests to help understand what was going on day to day in correlation with what a woman sees on her chart. So the kind of problems that can be determined, and I'll show you some charts in a little while, are almost all the problems that a woman might present to her gynecologist and or her regular doctor about. So infertility is a major one because a woman can appear to be having normal cycles and yet not be able to achieve a pregnancy indicating that there's something hormonally going on, or something with the ovulation process going on, or something else in her system that can be determined if a doctor knows how to test correctly based on the timing of the chart. Recurrent miscarriage also is based on a hormonal deficiency that can only really be found if a woman is following her chart. Prematurity is tied in with the same kind of progesterone deficiency as recurrent miscarriage. Postpartum depression is really a hormonal deficiency. It's not a problem of socialization or adjustment. It really has to do with the drastic hormonal changes that go on after a woman delivers a child. And irregular cycles, abnormal bleeding also can be evaluated much more exactly using this system. You'll see further on that ovarian cysts have a very characteristic pattern that can be picked up if a woman is charting. Likewise, polycystic ovarian disease, I will show you an example. Premenstrual syndrome is a very common problem. A lot of women have varying degrees of mood changes, irritability, crying for no reason, emotional ups and downs, unexplained fatigue, pain, bloating, abnormal food cravings, sleep disturbances within the week or so before the period. Headaches, migraine headaches are also a big issue there, and they can be hormonally mediated. And this system with the hormonal evaluation and treatment using progesterone that is exactly identical to the progesterone that a woman would normally produce dramatically improves that problem in a way that the artificial treatments and the treatments with antidepressants that are the common way of treating it don't really address. Chronic pelvic pain also can be understood as well as other kinds of hormonal abnormalities. Sometimes this gives a clue to thyroid disease or diseases involving cortisone deficiencies. So in order to understand how this system works, you need a basic understanding of human reproduction. So I have to give a little nod to the man's role in human reproduction because he is important. He has a totally different kind of design from women. Men become fertile at the time of puberty when the testosterone level goes up, and their fertility is fairly constant from then on, barring severe illness and certain medications. There's a little decline with age, but men, by God's design, are meant to be a constant feature. Women have a completely different kind of system. They're completely complementary to men. They have a cycle every single few weeks to months. It can vary from woman to woman and depending on her condition. But this gives you an idea of the different levels of what goes on. There's another slide that is a little bit better for this. The different levels of what goes on with a female cycle. I have a picture of the brain because it's really the brain that controls all of this. So messenger hormones come from the pituitary gland in the brain. They give messages to the ovary, which produces different hormones that give messages to the uterus and to the cervix, and the hormones of the ovary then send messages back to the brain, which produce a different signal. At the beginning, this FSH, follicle stimulating hormone, tells the ovary to begin to form one egg out of the many millions of potential eggs that are there. So that's kind of a mystery. Why is this one particular ovum chosen that month? But every month, one is chosen to potentially be fertilized. As that egg matures, the lining of the egg produces estrogen. The estrogen tells the uterus to build up its lining in preparation for a potential pregnancy. That also gives a message to the cervix to produce a kind of mucus that helps the sperm become more able to fertilize the egg. And the estrogen also, I'm sorry, I have to keep going back and forth. The estrogen also then sends a message back to the pituitary to send out a new message in order to release the egg from the ovary. A new hormone called progesterone is then elaborated, which increases the cushioning of the uterus. It helps promote the egg traveling down the fallopian tube to be fertilized. It changes the mucus at the level of the cervix so that the woman then sees a different sign when she's evaluating her chart every month. So this is just in words what I tried to tell you, and it shows you that there's a continuous message and a continuous feedback to the brain in a cyclical fashion. And every single part of that messaging system has to work correctly, has to respond correctly to the message, and has to send the next message on. So there's a lot of moving parts, a lot of things can go wrong. It's really pretty amazing that anything ever goes right with all the different things that have to cooperate with each other in order to work correctly, but it's an amazing design. So this is another scheme that shows you, in conjunction with the estrogen level and the progesterone level, what is happening within the ovary as the estrogen rises, that's secreted from the ovary, the follicle matures, the egg is released. The tissue that's left in the ovary is what produces the progesterone, and that's called the corpus luteum, which is, I'll refer to a little bit later, and then that cycle starts all over again. I included this slide because it's so important to understand that the cervix is a reactive organ, just like the rest of the reproductive tract, and these are the two types of mucus that the cervix releases. You can see here that under the influence of estrogen, the cervical mucus is like a superhighway for the sperm. You can see this electron micrograph shows a few sperm being able to swim right up. It's helping them get up into the upper part of the uterus, and the fallopian tubes where they are able to fertilize an egg. In his wisdom, God also created a pattern within this mucus to remove any defective sperm, because out of the millions and millions of sperm that men produce, there's a few defective ones. And it's important to know that in artificial reproductive techniques, where outside the body, the doctor takes a sperm and takes an egg and fertilizes it, this process of kind of hazing out the defective sperm doesn't happen. So nature is able to pick the best sperm to fertilize that egg that month. So it shows you that there's kind of a pitfall in what scientists sometimes think they can do when they're creating life on their own and not relying on what God intended for the creation of life. So the last two pictures show us the type of cervical mucus that's produced in the second half of the cycle after ovulation occurs, when the mucus becomes kind of a barrier to sperm, and it actually renders the woman essentially unable to become pregnant because the sperm cannot get through this. There's no channels for them to swim. They can't really find their way. This electron micrograph shows, I don't know if you can see this sperm kind of swimming but not having any luck getting through any of this labyrinth, which is kind of like a web that just catches it, and the sperm are unable to go any further. So during what's called the fertile window, around the time of ovulation, a couple of days before and a couple of days after, that mucus encourages the survival of the sperm and the motility of the sperm and allows it to live for a few days. But when the mucus is what's called hostile under the influence of progesterone, the sperm die within hours. So their lifespan is really dependent on what's going on within the woman's reproductive tract. It's not specifically just what they're programmed to do by themselves. So this slide shows you what a woman would see if she were charting her cycle using the Creighton system and observing the changes over the course of this approximately month. This one is 29 days long in her cycle. At the beginning, excuse me, you can see the characteristic blood. Then the first few days, there isn't really anything to observe. These days are considered dry. The chart is coded by using these white stamps to show when the mucus begins to build up, indicating fertility. When that mucus changes, the day after it changes, then you know when you've ovulated. And 3 days after ovulation, because that's about as long as the sperm could survive once the mucus changes, is considered to be, again, an infertile time for the woman, and she generally has more of a dry type of appearance to the mucus. Now, because Dr. Hilger studied what was going on with women every single day of the cycle, he verified that there's a buildup of estrogen that exactly correlates with what's going on the charts. And this correlates exactly with what the woman is seeing. So you don't have to have your blood test checked every single day to know. You just have to look at the cervical mucus, and it's very simple to understand. Once that drops, the effect of the cervical mucus begins to change. And again, after ovulation, he documented the buildup of the progesterone, and that's reflected exactly in the change that we see on the chart in the mucus. So it's a very exact system in letting women see what's going on with their cycles. So you don't have to have a blood test every day to understand it, but he's done it ahead of time in order to show what's going on with every observation. Okay. This is just another schematic of the cycle in order to show you if a couple is using this system in order to either prevent pregnancy by avoiding having intercourse on the fertile days, or to achieve pregnancy by timing ovulation, timing their act to ovulation. The majority of the time, the woman is not fertile. So it's important to understand that, because some people would say, well, this is too difficult to use, but it actually isn't, because there's a lot of infertile time. This is the time of ovulation, and any time of bleeding is also considered fertile, because you can't always tell what's going on at any time of bleeding. This chart helps you understand that for an individual woman, a normal cycle can still vary significantly in length. So each one of these cycles is normal in that there's a buildup of mucus, there's ovulation, and there's the typical change in the mucus after ovulation. The variation in length is accounted for because it's the ovulation process that varies from month to month, because the ovulation process is influenced by many, many factors. So if a woman were just using timing to tell what's going on with her cycle and came to a doctor, say, complaining of premenstrual syndrome, feeling like she had something off with her hormones, if the doctor didn't understand the timing of ovulation, blood tests would be completely unreliable, because the standard approach for a doctor who isn't trained in NaProTECHNOLOGY is simply to check a blood test on day 22 of the cycle, assuming that women have ovulated by day 22, assuming that most women ovulate about day 15. So for this woman, day 22 is after ovulation, but it's at wildly different points after ovulation from each cycle. So he would only be correct 1 out of 3 cycles in the measurement for this particular woman. So it's very inexact. Or if this couple were trying to use timing to not get pregnant or to become pregnant, they wouldn't be able to rely on the calendar alone. This chart would help them significantly to understand what's going on. This is another example of a woman's chart. She didn't ovulate at all until day 27. So a day 22 blood test, if someone assumed that would be after ovulation, that would be completely unreliable for this person. These are examples of problems women might be having who come to the doctor complaining of infertility, PMS, pain, prior pregnancy loss, and abnormal bleeding. So the first cycle is actually normal in length, but it's only with charting that the woman, the practitioner, and the doctor can see that she actually is having almost no estrogen buildup. You probably can't see too much of the numbers, but the fact that it's all green before indicates that she has almost no estrogen buildup. And if she were to get a hormonal profile, she would be shown to have very low estrogen and resulting very low progesterone, which could easily be treated using NaProTECHNOLOGY. In the second line, the miscarriage, this woman is apparently ovulating, but her progesterone level is dropping off dramatically much too soon. And that can lead to miscarriage, repeated miscarriage. Often doctors who aren't trained in NaPro just say, well, 1 in 8 women has a miscarriage. It doesn't really mean anything, but it does always mean something, and it can actually be prevented even before it happens if women begin charting before they begin to attempt to have a pregnancy. This woman is very likely having severe premenstrual syndrome. She's ovulating normally, but she has very early bleeding and spotting and a short effect, again, after ovulation of the progesterone. So that can be evaluated with precisely timed tests, and it can be treated with precisely timed administration of progesterone that's just given for 10 days after the woman ovulates. This cycle warrants a lot more evaluation because she's having very abnormal bleeding and she's also apparently not ovulating. So this is a hormonal demonstration of what was going on with the woman in the previous chart who had a miscarriage. You can see that at the end of her cycle after ovulation, her progesterone levels are very, very low. So it's, again, verifying exactly what the chart is telling us. And that can be very easily treated, again, using what are called bioidentical hormones in the form of progesterone. This demonstrates a fairly common condition of polycystic ovaries, where women have very long cycles and they have quite irregular bleeding. You could see this woman didn't ovulate until day 30. She had very irregular bleeding after that, and if she weren't charting, it would have been thought that it's just another one of her irregular periods, but in fact, because she could see that the bleeding occurred not related to ovulation, the practitioner realized that something was very wrong, and she had an investigation. And in fact, this woman who thought she was just having irregular cycles turned out to have an early uterine cancer. So this is another way that the system can help in diagnosis that might otherwise be delayed. Another example of the kind of abnormality you can pick up, this woman was having pain and an abnormally long cycle. It shows that there's a persistent estrogen effect in the cycle, and in fact she had a cyst that was continuing to secrete estrogen. And that actually can be treated very easily by an injection of progesterone at the right time. This is another kind of cyst that can form from abnormal ovulation that gives an abnormal looking chart, and with NaProTechnology is fairly easy to treat. Many factors can change ovulation. This one shows a woman who thought she was doing something healthy for herself. She began to a drastic weight loss and exercise program, but you can see that by the third cycle, these were actually suppressing her ovulation and suppressing her estrogen levels. So almost any drastic change physically can change ovulation. So if she were following this for the purposes of becoming pregnant or not becoming pregnant, she might realize that there was something wrong that needed to be adjusted, and that can just be changed by getting back to some balance in her life. This shows emotional stress, which can't necessarily be avoided, but it does have a significant effect on delaying ovulation. So the stress that occurred in this cycle, death in the family, continued to have an effect on ovulation in the next cycle. And again, if we didn't understand the effect that stress was having, it might be thought that something else was going on here, but it's clearly the effect of stress, and it helps a lot to be charting to understand that. This is a different kind of stress. This is actually from one of my patients who had severe Lyme disease and was on antibiotics for many months. She was still recovering during the timing of this chart, and she still didn't feel well. And some of what was making her not feel well was not the residual Lyme disease, but it was the effect on her system of having had a severe illness that was completely throwing off her estrogen and progesterone levels. She ovulated, sometimes formed abnormal estrogen levels a couple of times in the same cycle. She had an early drop-off of progesterone, which we verified by doing hormonal levels, and actually with correcting her progesterone levels, she began to feel much better, even as she was continuing on the antibiotics. And she eventually did become pregnant, which she wanted to do once she was done with the antibiotics. I included this slide from a woman that is taking oral contraceptives and charting at the same time, because people are told that the birth control pill suppresses ovulation and that that's how it prevents pregnancy. But in fact, the birth control pills don't always suppress ovulation. And here you can see that in each cycle, this woman is ovulating. So what's happening also with the birth control pill is, because it changes a woman's hormones drastically, it doesn't allow for implantation if there is a fertilized egg. So much of the time it's actually causing a type of abortion to occur rather than preventing conception from occurring in the first place. So I think this is very illustrative for people who don't understand how the birth control pill really works. Doesn't always suppress a woman's hormone, it just changes them and adds those artificial hormones on top of it. This is an example from a NaPro doctor who does a lot of infertility treatment of a woman who was charting and going to a regular reproductive endocrinologist who did artificial type of reproductive techniques at the same time. So from this woman's chart, it's pretty apparent that she has a lot of abnormalities, particularly in progesterone, and she doesn't ovulate with every cycle. Almost every other cycle, these two she did not ovulate. This one is unclear whether she really ovulated. And when she doesn't ovulate, she doesn't produce adequate progesterone, so her body is not prepared to receive a pregnancy. And yet, the artificial reproductive specialist performed a procedure in these two cycles which involved inserting an egg and a sperm into the fallopian tubes in the hopes of achieving fertilization during a cycle where she had essentially no progesterone. So of course, those very expensive and very invasive procedures didn't work at all because the doctor didn't investigate what was really the underlying problem. Whereas once she came to Dr. Boyle, this infertility specialist who's in Ireland, these problems were then corrected with the types of techniques he used in conjunction with normalizing the woman's system so that she could eventually become pregnant in the normal way. I'm going to skip actually to the infertility treatment first. In the vitro fertilization techniques, I'm sure if any of you know people who've been through that, you know how heartbreaking it is, how much difficulty they have, and how limited the success is in most of those cases. And they're successful in no more than 25% of the time. Whereas NaProTECHNOLOGY, because with the charting, the exact underlying problems can be determined, there's a much higher success rate, essentially double what's achieved with in vitro fertilization, and sometimes even better in conditions like polycystic ovaries that can be fairly easily corrected simply with the correct hormonal replacement. Endometriosis in NaProTECHNOLOGY requires surgical treatment also. So NaProTECHNOLOGY uses all of the medical techniques that are available to us that help a woman's body function normally. NaPro surgeons are specially trained to remove endometriosis and prevent scarring with surgical training that is different from what the average OBGYN receives in his training. So it's an additional training that a NaPro surgeon would do in order to be able to treat endometriosis, which affects at least about 10% of women and is a big cause of infertility and of ongoing pain. So I'll go back to the slide that talks about success rates in couples that want to prevent pregnancy. It's basically comparable to contraceptive techniques, and we don't really like to think of this as a contraception. It really is working with God's plan for life and discerning month to month how that couple wants to use their fertility. If they've discerned that they want to use it to avoid pregnancy, they have to act accordingly, as opposed to contraceptive techniques, which again remove the essential meaning of the marital act from its procreative significance. But used correctly, it's 99% effective. So it's a very, very effective technique, which has other benefits also, besides if a couple is trying to avoid pregnancy. It has significant benefits to a marriage, improves communication, helps with fertility appreciation. There's often a greater appreciation of the husband for what actually is occurring with his wife's cycle every month. They learn other ways of expressing their love for each other. This is something that fertility care practitioners like Maurice talk about a lot in their consultations with the clients. But it also is completely natural, doesn't involve putting any chemicals into your body which have potential carcinogenic effects. They have metabolic effects. Often the artificial progesterones actually have what are called androgenic effects, so they act more like male hormones in a female body than the female's natural hormones would act. Another area that NaProTECHNOLOGY is more successful than standard medical treatment is in premenstrual syndrome. I don't have a slide on that, but it's about twice as effective as the standard treatment of Prozac. So SPICE is really the fertility care practitioner's forte. which talks about the different levels of communication that are important for a couple in developing their marriage. There's a book, actually, that we have a copy of, but it contains beautiful testimonies of how women have benefited from charting and from having their problems treated in NaProTechnology when they weren't able to find help anywhere else. For instance, this particular woman talked about not understanding what the pill was doing to her body, not feeling well on the pill, not being able to be given any explanations for why she felt the way she felt, until she was able to come to a Creighton practitioner and learn how to chart. This is another testimony about struggling with achieving pregnancy and infertility. Women who've had multiple miscarriages have been significantly helped with this technique, because usually there are many, many abnormalities there too. Often these women are suffering from pelvic pain and premenstrual syndrome, and in addition to helping their fertility, their entire well-being is benefited from this. This is another testimony about premenstrual syndrome and how much the treatment for this was helpful. So what could be the next step? Certainly this is beneficial for our couples. It's beneficial for women who aren't married to understand their own fertility and empower them to manage their own health. It's also something that helps to build up the church because it strengthens families. So whatever you can do to evangelize your own parish, evangelize your doctor. Doctors really need to learn about this. So you have to keep at them because they might be a little bit reticent to think that they don't already know everything, but there's a lot we don't understand. And Maurice also is the expert in helping women learn how to chart. So fertility care practitioners are really key in helping couples understand this. So thank you to Maurice, thank you Bishop Gregory, thank you to the Diocese of Brooklyn, and thank you all for coming and listening to this presentation.
Just before Dr. Eleanor will start with the questions, I just want to go back to a few stories from this book, which is available there. We have this book if anyone is interested. This is the first one. This is actually the first story in the book. With the Creighton model system, couples make joint educated decisions. This is a story of a couple who got married, didn't even think about what they're going to do for family planning. They just followed the culture. This woman did what all her friends were doing. She went to her OBGYN and she asked for a prescription for the birth control pill, because they were planning on not getting pregnant the first 5 years of their marriage. She started taking the birth control pill. After 6 months into their marriage, she didn't get her period. So she got so worried, she just thought that the birth control pill might have failed and she got pregnant. She decided to go back to the birth control pill booklet and read it. And when she read it, this is what exactly she said. The small booklet explained exactly what the pill was doing to my body. I was sick. When I made the decision to go on the pill, it was not an educated decision. I had not even given a thought to the process of how it worked. I simply was following the social norm. I could not believe I was dumping these chemicals into my body. There was nothing natural about the pill. And then she also said, no wonder why infertility was on the rise, because she realized that her body stopped working the way it's supposed to work. So she didn't go back to the OBGYN office. She stopped using the birth control pill. And they were moving at that time from Omaha, Nebraska to Virginia. So she kept wondering, what can they do? She remembered that she learned about natural family planning and the marriage encounter weekend. But a lot of people think of natural family planning as the rhythm method. So they just think it's not scientific, it's not accurate. So she and her fiance at that time, they joked, they said, if we're gonna use something like that, we're gonna have tons of children. So she didn't even consider it. But at that moment, she was like, I need something, because the birth control pill was obviously messing up with her body. So she saw a brochure like the ones that you saw on the chairs, a brochure for the Creighton model fertility care system. She contacted the practitioner, and then the practitioner did an introductory session for her. And the introductory session is the first step for anyone to learn about the Cretan model system. After the introductory session, the couple or the woman would sign up for private follow-up sessions where they will start learning how to chart their cycle, and then they will see the practitioner on every 2 weeks for 3 months, and then after that every 3 months. So she started charting, but when she began, she was really thinking she's going to get pregnant very quickly. And then she was amazed to see how scientific it was, and they used it for 5 years as they were planning to avoid getting pregnant. And then, because it was so successful to avoiding pregnancy, they assumed it's not going to work to achieve a pregnancy. But then 9 months after their first attempt, they welcomed their first child. And then, second time they wanted to achieve pregnancy, they got pregnant immediately. The third time, she didn't get pregnant immediately, but because she has been charting with the Cretan model, it was easy to help her. So, at the age of 40, she delivered her third baby. And she says, after that, she says it was gratifying to have one method that can be used in all stages of my reproductive life: avoiding pregnancy, achieving pregnancy, breastfeeding, and even, as we were about to find out, infertility. Because they found out they had a problem, they treated it, and she got her third child. She had only one regret, she says, that we did not enter into our marriage with the Cretan model. Because once they learned it, not only it helped her to be empowered and in tune with her body, but it was something that we're both able to do. And she actually says here, the method had worked so well for us, and my husband took an active role in it, that I am sure he knows more about the ins and outs of the female reproductive system than most women do. And it's so true, it's a shared system between the couples. It really empowers women, but it also allows the man to be part of this. After all, it takes the two to get pregnant, it's not just the woman. So the Cretan model has really been changing cultures and changing mentality. There was a story that I like to share always about a practitioner who was engaged, and when she and her fiancé were engaged, the priest made it required for them to learn the Cretan model system. They were using the birth control pill, and they were having intimate acts of intercourse, and they were not willing to change their lifestyle, but they had to learn the system because it was required by the priest. So they went, she attended an introductory session, and she was fascinated by the science of it, and they decided to give her a trial. And when she was coming to the follow-up sessions, she was challenged by the practitioner to give up their lifestyle and to use more spice in their relationship. And spice is a way for the couple to express their love to each other, but not by having intercourse, but in those 5 aspects: the spiritual, physical, intellectual, communicative, and emotional. So that couple eventually, as a result of those follow-up sessions, stopped being intimately active, stopped using the birth control pill, and they saved intercourse until they got married. And the best part of it, she was Jewish. She ended up becoming Catholic after understanding this teaching and how the church really is looking after women through this teaching. So a lot of misconceptions are there about the system. And that's why we wanted to do this seminar, to help you understand what it is about. And we want you not just to learn it or hear about it and just forget about it. We want you to be really active in spreading this message, whether it's for your own personal use or your daughters, or just to let someone know. We all know someone who have either infertility problem or suffering from miscarriages, or maybe have PMS or polycystic ovarian disease. The list goes on. We all know someone that can benefit from this information. So let us try to spread this word out, because you're not going to hear about this anywhere else, unfortunately. Even though this is good for women, good for marriages, good for families. But the media stream is not about what's good. It's about what's more beneficial, and we all know this. So please, if you have any questions now, Dr. Eleanor Snowden is here. She will be answering your questions, and if there are any questions for me as a practitioner and educator also, we're more than happy to answer your questions. And I know that Doctor had touched a little bit on in vitro fertilization. Some of you here were probably looking to hear more about this. We didn't want to go into a lot of details about this, but we really want to let you know our system, the Cretan model NaProTECHNOLOGY, really offers hope and healing for couples struggling with infertility. We do not offer anything 100%, because after all, it's God who does things. But our approach is really completely different. And I can attest from my own personal experience. Christian shared his own personal experience with natural family planning at the beginning, and I'm going to share something now related to in vitro fertilization. In our infertility journey, we had to go to a fertility specialist. And I remember in the office spending only 5 minutes with her. That's how much of her time she gave us. But I will never forget her words to us, never. We will make you baby in the lab. It was just so heartbreaking. It felt like as if she's making me a sandwich in the kitchen. That's how it sounded. It's not like she was compassionate, realizing that infertility is a disease, and I call it the silent cancer, because you cannot express it to people, you cannot talk about it, and people would not sympathize with you, like if you have another sickness. I remember it was heartbreaking, but we were going to do it, because that was the only option offered to us. But I remember when we attended the session about in vitro fertilization, I just left the office crying. And I went back home and I told Peter, find another woman, I'm not doing this. I'm not having children through this way. I just felt like discarding the embryos, the way they retrieve the eggs, the way they get the sperm from the man, all of this is just dehumanizing. And I just felt I cannot take it. So my friend did my homework. She went and researched and she found out about NaProTECHNOLOGY and Polycystic Institute, and she connected me with them. And I remember the first time I had an appointment with a NaProTECHNOLOGY doctor like Dr. Eleanor. It was Dr. Watson who retired now, Dr. Leonie Watson. She spent with us 1 full hour in her office, explaining the whole procedure, everything that they do, so they can help us figure out the problem and treat the problem. It wasn't just 5 minutes. It wasn't like we don't care, no. It showed that when they look at a patient, they're not looking at how much money they're gonna make, but they're looking at really treating every person with dignity and trying to identify the problem and help them. So our approach is very different, and that's why, unfortunately, maybe, I don't know the exact number, but if we were to look, take up a population of OBGYN, I don't think it's even 20% of them that are NaPro doctors.
Oh, no.
Because it takes a lot of dedication, yeah. It takes a lot of dedication and commitment on behalf of the doctor to be able to do something like that. To be able to say, I'm not going to prescribe birth control pill. I'm not going to recommend, send for in vitro fertilization. I'm not going to encourage abortion. All of these things that unfortunately all the doctors encourage for them. So please, if you have any questions, we're here to help you. And when we're done, feel free to check our resources table. We have a lot of materials out there, and feel free to take those brochures on the chairs. Any questions, comments? I know some of you came late, so you missed on the beginning of it. I'm sorry.
You're fine apart, I'm sorry.
Yeah, that's okay. Anything specific that you were waiting to hear about, to know about it, to become more educated about it? Don't be shy. احنا لبنانيين بنحكي كتير. لا بس يلا. Yes, Sayyidna. Thank you for taking the lead and asking questions, Sayyidna.
It's more a statement.
Okay.
But I just love this technology because it deals properly with how complex the
endocrine system is. I love the way that it doesn't make it it's a simple fix for a very complex challenge. And so for those who want to be pregnant and those who want to space their children out, it is the best medicine, the best remedy offered by science and the wisdom of the church, especially through Pope Paul VI, Humana Vitae. And I love how you presented it. You give us the science behind it, as well as as Maurice did, the practical aspects about it. So, Doctor, maybe you'd want to tell us a little bit about how you personally have come to the same conclusion as Maurice and others.
Well, initially, I was doing all the things that most doctors do in their practice. I prescribed birth control pills. I, would refer. I had nothing negative to say about in vitro fertilization. I really didn't understand that there were any problems with any of these things. in spite of the fact that I identified myself as Catholic all that time. And in observing women, especially women who were on the birth control pill, but in observing women who were contracepting, I began to see that many of them were depressed. Many of them had all kinds of physical issues that couldn't really be explained. All their blood tests looked fine, but they just didn't feel good. Or they couldn't figure out why they were gaining weight, or they couldn't figure out why they were having all kinds of allergic reactions that they never had before. And it took me a while of observation, but it seemed like there was a correlation between these women who weren't feeling good physically, weren't feeling good psychologically, and the fact that they were on the birth control pill. And I began to really want to have something to offer them besides the birth control pill. When they said, well, you know, I have irregular periods, I have to take the pill. I have ovarian cysts, I have to take the pill. I have acne, so my gynecologist put me on the pill. There were all kinds of reasons in addition to they were also using it for contraception. And part of it was lifestyle related, I think, but also within a marriage, that contraceptive approach, as Polycystic explained, leads to problems that often people don't really understand, but they're kind of unspoken problems. And at the same time, I was somehow being called forward in my faith journey. So just ended up meeting a woman who knew about NaProTECHNOLOGY, and as soon as she found out that I was a Catholic doctor, said, you have to do this, and took me to one of the training sessions that happened to be going on in Connecticut. Took me there year after year, probably 3 years in a row, and every single time I said, I could never do this. This is way too involved for my practice. The training is too time consuming, I can't take the time off. And finally, I think a priest maybe I heard say at a meeting called the Gospel of Life, that we really need a doctor in our diocese who does this. It's you know, a disservice to women that there isn't anyone doing this. And finally something clicked and I just said, I have to do this. Nobody else is doing it, so I have to do it. And I took that time, which is very difficult for anybody to take 2 extra weeks off from their job, from their practice, away in Omaha to learn this. And it was actually involved a lot of study, which surprised me since I already had medical training. I thought I would already know it, but there was a lot involved to learning it. And it's in trying to integrate it into my medical practice, it's true what Marie said about the time a doctor spends. It really does require time, and that's another reason that it requires sort of realigning your practice, but it's very, very worthwhile. Because even in standard medical practice, doctors don't spend enough time with people. There's a lot more to delve into with any issue than the standard 15-minute visit. That's another disservice to people no matter what their problem is. But particularly with these kinds of issues, there are so many aspects to it that I've tried to carve out that time to give the women the time they need. So it really was part of my faith journey in trying to understand what it really meant to be able to track this, to treat in accordance with God's plan, to help women understand how they're created. You know, fearfully and wonderfully made really applies. And I think this helps women. It really helps them understand their inherent dignity when they see this. And as you say, Bishop, it's not simple, you know, and there's a lot to be said for understanding that we're not simple, and there's no simple answers always either, but that's an important thing to know. Maurice alluded to the fact that often you'll only learn about this within the context of a church, but there's a lot to it that it's definitely enhances your faith, but it's also in keeping with the viewpoint now that we need to be all natural, we need to conduct ourselves in a way that is in accord with the environment and not harm the environment. And the Creighton system and NaProTECHNOLOGY are in accord with all those things. You know, we avoid putting any artificial substances into our bodies, and so we avoid putting any artificial substances into the environment as a result, because all of the artificial hormones that women are taking are going into the environment, and that's actually having an effect. So I hope that explains the question. It's been partly faith and partly just wanting to understand more so that I can help people in a meaningful way. So if there are any questions, I know I've talked about this from a scientific viewpoint. I don't always see what it might be for you to hear because I'm so used to the science, but if there's anything you would like to have explained in a different way, I'd be happy to do that.
If you don't have any questions publicly, if you want to ask some questions privately, we'll be available after the session. So if there are no group questions, we can end with a closing prayer from the bishop, and then Dr. Eleanor and myself will be available for private questions, because I think some of you have questions. I know you. So no, please.
I have a million questions, but I'll hold on. Now, a couple of things, Doctor. I think this is not something people can make a lot of money on.
No. That's probably why the Gianna Centers, I meant to mention the Gianna Center in Long Island with Dr. Paul Carpentier, the Gianna Center in New York with Dr. Ann Nolte are not far away.
Yeah.
So those are very good resources also for you in this
And
area.
So in vitro fertilization or putting someone on the pill is very, very easy and very financially lucrative for the doctor and for the drug companies and for everyone else involved. This has nobody makes money on this. In fact, if the person goes, they're very minimal charge to help themselves to chart their own cycle. So there's not a whole lot of money involved. That's first. Second, it is so natural. And it's crazy. Our world loves natural foods, natural things, but when it comes to a woman's fertility, it's the most unnatural. Putting a substance into the body, it changes their whole cycle. It's unbelievable. And I'm sorry, women buy it hook and sinker. It's terrible. And who does it benefit? Those who are making money out of it. And the men, to be honest, because the men don't take the time to learn their wives, who are their precious life partner, learn the complexity of their wife's natural fecundity. So this is an uphill battle, and I'm glad Maurice and Peter are willing to do this work for our diocese. By the way, Maurice gave this presentation to 55 bishops in our patriarch in fluent Arabic. It was the first time they had any idea something like this existed. And I think it was a miracle drop from heaven that they even allowed her, after I pushed so hard, to speak to them. And we had 1.5 weeks of meetings, and this was by far, this 45 minutes, by far the most helpful of all those week-and-a-half meetings. So Maurice, thank you and Peter, thank you for presenting. And I hope that Lebanon will also take this when you go next time. And lastly, thank you, Doctor, for coming, you and your husband. It's so good of you to come, and so good of you to have changed your whole practice to accommodate and help women.
Part of it. You take the whole thing.
Okay, but I mean to take this into your practice so that you can help women to find their own health and well-being. So, in the name of the Father, the Son, and the Holy Spirit, amen. Heavenly Father, we thank you for science, and we thank you for faith. We thank you for the courage of those who will make less money and be more helpful to others. We thank you for the fact that you enable us to pass so profound and so good for others. And we thank you for all those who attended here and online. And we ask you to bless us in the name of the Father, the Son, and the Holy Spirit. Amen. Thanks, everyone.
Thank you, Sue.
Thank you.
Thank you, everyone. Thank you. Please feel free to check our material table, and we're around for any questions. Thank you so much for coming. Thank you.